Okay, so now we're going to have a look at assessing cervical joint position and movement sense. So first of all, we need to check the position of the patient, and we need the person to be about 90 centimetres away from the laser to the chair. So that's perfect. So we're going to pop the laser on. And ask the patient to just be in their relaxed, comfortable position. Okay, and then we're going to pop the laser, the target, and align it in the centre where the laser's sitting. Okay, and then we're going to ask the patient to close their eyes, concentrate on that straight ahead position. And then she's going to turn her head, we'll go to the left first, as far as she can comfortably go. And then she's going to come back to that straight ahead position and just say yes when she thinks she's there. Okay, we take note of where she has landed, and then we reposition her back to the centre without keeping her eyes closed. Then she's going to go back to the left again, as far as she can comfortably go, and come back to the straight ahead position. We're noting whereabouts she's landing. That's good. And then going once more and coming back to that straight ahead position. Yeah. Okay. So Lucy's fallen every time within the yellow circle. So that means that's considered within normal limits. So anything outside of that, some people will even be off the chart, that would be considered abnormal. So for research, we do about 6 to 10 repetitions, but for clinical, I think as long as you have 3 consistent attempts, that's okay. So Lucy's consistently had a normal response there. So then we're going to get her open her eyes, concentrate on that straight ahead again. Then she's going to close her eyes and turn her head to the right as far as she can comfortably go. And then come back to that straight ahead position as accurately as she can and say yes when she thinks she's there. And again, we're going to reposition her manually back to the starting position and go again, round to the right and come back to the straight ahead. Okay, and then once more, going to the right and coming back to the straight ahead. So she's got her eyes closed for each. And again, she's falling within the green for all of those 3. So we would consider that a normal response. Then we can have a look at neck extension. So eyes closed, taking your head back as far as you can comfortably go, and then coming back to that straight ahead as accurately as you can. Going again, taking your head back and coming back as accurately as you can. And once more. Okay, and so for this test, Lucy's consistently falling outside of that. And we could measure that distance from there to there, and we could write that distance down as an indication of an outcome measure to see whether it's improving with training. Okay, just want to see if you can actually see the laser.